This is Jennifer Bagwell, the SDC at Life Care of La Center. In our November 2024 in-service meeting, our staff covered the most missed questions from the skills fair and communication with cognitively impaired. And then the nurses and the CNAs also covered transfers and pressure ulcers. On our skills fair, the question on enhanced barrier precautions, this question was false because of the respiratory illness part of the question. EBP is for those with wounds, indwelling devices, and an MDRO, which is a multi-drug resistant organism, such as MRSA. If you're going to put hands on the resident, you want to make sure that you have on gown and gloves, and those gowns are located in the resident's bottom dresser drawers. And of course, the sign is going to be above the resident's bed, indicating that you are supposed to use enhanced barrier precautions. For infection prevention, number one, that question is true. If you break one link in the chain of infection, then that infection is not going to occur. So for instance, with hand hygiene, you're killing that organism, and then you're preventing it from getting into your body in the first place. Same thing with PPE. You're blocking that organism from getting into your body. Or what about a vaccine? Well, in that case, you're killing the microorganism, and once again, that's breaking that link that in that chain of infection. So the infection doesn't occur. So that question was true. On the privacy curtain question, number 2, you want to touch those privacy curtains before you wash your hands or put on gloves, because they are not washed frequently, and so they are exposed to quite a bit of germs. So number 2, that was false. Number 3 was supposed to be about killing of microorganisms through heat, which is sterilization. However, on your handout, I listed the wrong question and listed question number 1 again, which was true. On transfers to wheelchairs, if you have a resident with right-sided weakness, then you want to put that chair on their left side. You want to put it on their good side. And they recommend that you put it at a 45-degree angle, though putting it parallel to the bed is acceptable, especially in our smaller rooms. For body mechanics, you want to carry any bulky or heavy objects close to your body. So that question right there was false. The exceptions are if you have clean linens, because you don't want to touch your clothes and have anything that you might have on them get on a clean linen. And if you've got a soiled linen or another soiled item, you don't want to hold those near your body because you might get it on you. So that question right there was false. On the OSHA pictograms, the first one where it's pouring the chemical into the hand and then onto the piece of metal, and it looks like it's eating it away, that means that that chemical is corrosive. And the exclamation mark means that it's either an irritant or some other hazard. So communication with the cognitively impaired is going to be those with dementia, such as Alzheimer's, stroke or brain injury, developmental disorders, and severe sleepiness. So things to avoid. Number 1, you don't want to raise your voice at these residents because they may start to shut down or their defenses might rise and then they don't hear a thing you're saying. Also, try to avoid interrupting them because sometimes they can lose their train of thought. And then when it comes to distractions, you may have to turn the TV down or off or get them off their phone or iPad or other device. You also don't want to rush them, as this can cause them to get overwhelmed and confused. Avoid medical jargon terms. So, for instance, if you ask them if they have voided for the day, they may not realize that you're asking them if they've urinated. And then lastly, you can see I put not a child. Our residents aren't children, so please avoid talking to them as if they were. Some tips on communicating. One of the biggies is just to keep it short and simple and one idea at a time. If you give them too many ideas at once, they usually only remember what you said either at the beginning or the end. Short answer questions are good, so like yes or no questions or questions that offer them choices. And also want to give them time to process. Sometimes they need a little bit longer time to fully understand what you said. And always remember that nonverbal behaviors can communicate an unmet need. So for instance, if they're sitting in their wheelchair and they appear to be a little restless and can't sit still, well, that can indicate that they might need to go to the bathroom. They may need to go to the bathroom, or something might be sticking them, like a tag in their pants, or they could just be uncomfortable. The next part is for my nursing and CNA staff. On the skills fair, one of the most missed questions was on calculating food intake. Had several that were counting fluids as food intake. But fluid intake should be counted under input and output, not as food intake. When it came to counting up percentage intake, when it came to foods, did pretty good on the 0%, the 75%, and 100%. Not so good when it came to figuring out the poor 25% or the fair 50%. So the poor is going to be 25% of your main course, or, and that's the key word, or 50% of one item. And then fair is going to be 50% of the main course and 25% of other foods. So the and is the big part of that sentence. On positioning, prolonged flexion, that can be just them making a fist, but if they are doing that for long periods of times, that can cause contractures, and you can see the photo of a contractured hand on the screen. And we use hand rolls to prevent this because it helps keep the fingers extended and keep that thumb in the right place. PT-INR. For INR therapy, the therapeutic range is 2 to 3 unless the physician says otherwise. And then to remember how to clean the machine, if you'll remember, INR stands for I need a rubbing, or rubbing alcohol, which is our alcohol wipes. That's what you can use to clean those machines. Glucometer, the word gluco actually tells you how to clean the machine. And it shows on the G that you want to clean it from side to side. The L is up and down. And then the U I turned into the number 3 because you want to do side to side and up and down 3 times. And then you want it to let it dry for 2 minutes. And so the C was turned into the number 2. And the O, if you look at the top of a Sani wipe container, there's an O on top. And so that just is to remind you that glucometers should be cleaned with Sani wipes. And then lastly, on the TB test, don't measure the red around where you gave the test. You only want to measure if it is raised. And you also don't want to put negative when you read the test. You need to put 0 millimeters. On our sit to stand lifts, you want to put the sling on their lower back, below or at their umbilicus. The calf strap is actually optional, but you want to make sure they have on non-skid footwear. And also, like you can see in the photo, they want the residents to lean back when they're moving and either hold the straps or the handlebar when they are moving. And then wipe the machine when you're done and plug it back up. For my nurses on pressure ulcers, just remember, if it's a pressure ulcer, that means it's over a bony prominence or it's caused by pressures such as underneath tubing. But for all wounds, length means that you're measuring it is from head to toe. Width means it's from one side of their body to the other side. And so sometimes, especially on foot wounds, you may need to picture them as if they were a ballerina standing on their tippy toes to be able to identify the length and the width. And then on the depth, which is the deepest part of the wound, if you see on that photo on the lower left-hand side, they've got the Q-tip stuck into the wound with the edge of their finger on the outside edge to help them measure the deepest part of that wound. When it comes to undermining, which just means that the wound edges are not together, which is that top, this one right here. If you can see, that just means it's right there underneath the edge of that wound, and we're going to use a clock face to be able to describe where that's at. So basically that one's, I would say, between 9 and 10 o'clock. And then tunneling just means there's a passageway that is in that wound. And once again, you're going to be using the clock face to describe where that tunnel is at. So on this photo right here, I would say that that tunnel is probably about an 11 o'clock. If you come across a new pressure ulcer, when you stage it, just remember stage 1 is just non-blanchable redness. There is no open skin. It is still intact. Stage 2 means we've got a shallow wound. So the epidermis, which is right here, that top layer, that's only about the width or the thickness of a piece of paper. And then on the dermis, the next layer, that's only about the thickness of a credit card. So it's a very shallow wound. And also serum-filled blisters, whether they are intact or ruptured, are considered to be stage 2 wounds. If it is a blood-filled blister, then that's considered a deep tissue injury. For stage 3, we know that it's stage 3 because we're going to be seeing fat, which looks like little globulations or globular tissue. You may also see some granulation tissue because of some healing that's already taken place. Other things that may be possible are the rolled edges, the apobole, the slough or the eschar. We might have some of that. And then we also may have some undermining or tunneling. What makes that different from a stage 4 is on stage 4, we're starting to see some fascia. We're also seeing some muscle, which is usually a dark red, almost a purplish color. A tendon, which it's striated looking and kind of narrow. We might also see some ligaments and bone. Of course, we still may have those rolled edges, slough and eschar, and undermining and tunneling. Now, if there's too much eschar and slough, then it might be an unstageable wound because we cannot determine the extent of the damage. So to practice, what stage is it? Number 1. That one is a stage 3. We have the yellow tissue, but if you can see, it's kind of a globular tissue, so that is fat. It also looks like we might have some undermining about 3 o'clock. So that's going to be a stage 3 wound. Number 2, looks like we've got some unblanchable redness, so that is a stage 1. Number 3, if you see the arrow, I have pointed to a piece of bone that's evident. We also, it looks like, may have some muscle that is being seen. That's that real dark red tissue. And so stage number 3 would be a stage 4. Number 4 is going to be a deep tissue injury. You can see that kind of purplish color, and if you push on it, it's probably going to be boggy or mushy. And those wounds usually occur on heels, though sometimes you may see them on the coccyx area after surgery. Number 5 is going to be a stage 4 because right here, if you can see that narrow piece that looks kind of striated, that's a tendon. And then we've got some muscle that's attached to it right there. So that is going to be a stage 4 wound. Number 6 is a serum-filled blister, and those are stage 2. Number 7, that is a stage 3. Looks like we got some fat, but I'm not seeing any bone. I don't see any tendon. I do possibly, I think, see maybe some rolled edges up here, and that might be a tunnel. But I'm not seeing anything that would identify it as a stage 4. So I'm going to say number 7 is a stage 3 wound. On number 8, that is slough. Slough is usually kind of that sickly yellow grayish appearing and usually stringy. And in this case, in photo number 8, it's covering the entire wound, so we can't really see how bad that wound is. On number 9, I initially was going to put that it's unstageable. However, it looks like we may have a tendon right there. It looks like we may have some muscle in here that's showing, and so they listed that as a stage 4 wound. Number 10, that's a very shallow wound, so that is a stage 2. Number 11, we're getting a little bit deeper. It looks like we're getting to the point we have some fat showing, and so that moves that along to a stage 3 because of the fat that we can see. And then number 12 is a stage 1 pressure ulcer wound, which is caused from the tubing. So make sure that you are looking under catheter tubing and then under like oxygen tubing, because they can get some pressure ulcers. So we need to make sure that we are inspecting the skin under those areas. If you have any questions on any of this, just stop by my office and I'll be happy to help you.